As a mom of almost 3 babies, one being 4 years old, one being 5 years old, I've had time to sit and simmer on my first 2 deliveries. And if you know my story from my previous videos, you know I've had a very traumatic first birth with a 3rd-degree tear and a non-latching baby. And then you know with my second birth, I ended up with a prolapse and a bladder that fell asleep and would not wake up after birth, and where I had to be on a catheter for a good 12 hours after birth. And let's not even talk about postpartum depression. Those traumatizing births have definitely led me to educate a lot more this time around, being 4 years later from the last birth I've had. In this video, I'm going to talk about 10 things that I'm doing differently as a mom of almost 3 babies in a hospital setting. The first thing that I'm going to tell you is I educated this time. And what you are doing right now, watching this video, is exactly what you need to be doing. You need to listen to other people's experiences and make your own decision on what is right for you. I listened to a book on Audible, and if you're new to Audible, you can get it for free, first book free, by a midwife. She basically talks about our hospital care system and why certain routine things are done at a hospital system that may not necessarily be in the best interest of you and your baby, but in the best interest of the hospitals. She will basically explain to you the background of all of that and educate you on how to truthfully give birth naturally the way we were intended to. My list is based on my previous experience. I am not a doctor, and it's also based on the things that this midwife discusses in her book. And basically, I'm aiming for an unmedicated orgasmic birth. You heard me right, orgasmic, not just pain-free, but orgasmic birth. The number one thing that I can honestly really encompasses everything is that you have to walk in and let your nurses and doctors know that before they do anything to you or to your baby, that they ask for your consent and they explain to you the risks of whatever procedure they're going to do, not to do it without you specifically saying, I consent to this. Our hospital care system tends to operate in such a quick manner and just get this baby in, get this baby out, go on to the next pregnant lady, to where they don't even sometimes take the time to explain to you what they're about to do. And I can tell you that because I've had to have a vacuum extraction birth with my first baby, and the doctor just looked at me after 3.5 hours of pushing and said, "Hey, I think we have to use the vacuum. Do you want to use the vacuum?" And that's pretty much all she said. She didn't explain to me the risks of birth injury, birth trauma to me or to my baby, what I could expect of doing that, and how it will impact my life for the rest of my life, because I may be living with a prolapse for the rest of my life. So it's really important that if you see a doctor or a nurse about to give you a needle, about to do anything, maybe put a monitor, an internal monitor in your baby to monitor your baby's heartbeat, they don't tell you that that's a needle. That's a needle that goes into the baby's head. They don't tell you that. They just do it. So please make sure that you vouch for yourself, or you have someone there to vouch for you, like getting a doula or telling your husband or your significant other, listen, this is what I want my birth plan to be. Please make sure that you vouch for me, especially if I'm unable to vouch for myself because I'm in too much labor pains or whatever it is. One thing that Ina, the midwife, discusses in her book is the sphincter law. Basically, believe it or not, your cervix can open and close with how you feel emotionally. So when they tell you, they could possibly tell you you're at 7 centimeters dilated, and then if you're uncomfortable, you can technically, the sphincter closes back up to a 5 centimeters, and she says that they don't necessarily acknowledge that in a hospital. So it's just like, I'm gonna give you a really good example. It's just like you going to the bathroom to have a bowel movement. You can't necessarily relax relax all the way unless you feel comfortable and you're in a private space and you feel comfortable letting go. And that is the sphincter, letting go, opening up and letting go. So who you have in your birth room is really important. The ambiance of the birth room is so important to your emotional health and positive manifestations. And I know it sounds crazy, and I used to say, oh, well, that's crazy. This is a physical thing that's happening, not a mental thing. But mental thing feeds your physical body. And that's why I say I want to have a euphoric birth. I want to completely engross myself in the positivity of the experience. I'm ready to take on the pain of birth, or I should say, I really want this to be a euphoric experience where I just let my body do what it needs to do. In the past, I've been strep B positive, and if you're far enough into your pregnancy, you know what this is. They test your vaginal flora for bacteria called strep B, and that is a bacteria that has a very, very, very small risk. Again, read or listen to the book. Very small risk of being transferred to your baby. But if it does get transferred, it can be pretty fatal to your baby. So I personally hoping my very best that I do not end up being strep B positive with my third pregnancy. I have been religiously taking probiotics, trying to drink kombucha. Okay, so I ended up getting my test done at week 36, and I was strep B positive for both my first and my second born children. So me coming back as a negative for my third was going to be very far-fetched, but I'm happy to report that the probiotics worked, and I actually did in fact come back negative. So definitely consider probiotics. And if you're curious about the supplements and probiotics I'm taking, definitely check out my supplements video. But I am taking all of that to make sure that I come back negative for strep B, and studies have shown that you can become negative if you are doing probiotics or taking probiotics as you need to, which I also mentioned in the supplements video. The reason I hope that I am not is because I will be refusing any fluids through IV, hopefully not having to take antibiotics if I'm strep B negative, but I will let them put an IV placeholder into my hands just in case of hemorrhaging or an emergency after I give birth or before I give birth. I will let them do that. However, I don't want to be hooked up to any bags, to any fluids, unless medically necessary. And when I say medically necessary, I mean not because that's their routine procedure, but because that is what I need at that point in time. And if I don't get it, things will go really bad. I will be refusing an epidural, and I will be refusing Pitocin, and Pitocin is what causes really aggressive contractions. I want my body to have its natural rhythmic contractions. I heard from lots of women that Pitocin contractions can be really aggressive and hurt a lot more, so you're more likely to need an epidural, and obviously you're going down that chain of intervention, which can ultimately lead to C-sections and vacuum extractions and all of that. So I really want it to be an intervention free.
You're doing great. Doing so good. Over? They're definitely speeding up.
I will use natural ways to bring on contractions if I need to. For example, breast stimulation using a breast pump. So I will be taking my breast pump with me, my Willow Go. And if you guys are curious about what I'm taking to the hospital with me, check out what's in my hospital bag video where I explain the reasoning behind everything I'm taking with me, especially as a third-time mom that has messed up twice, which leads me into point number 4, changing positions. it's so important to give birth instinctively. I will not be listening to what the nurse says. For example, if she says, hold your breath and then push for 10 seconds or push until I count to 10, that's called purple pushing. It's really bad for you. It's really bad for your pelvic floor. And especially when you're on your back with an epidural, it can only lead to bad things, and take it from someone that has gone through bad things. I will be pushing the way God intended me to push. I will also try not to push at all. I will try to breathe the baby out. So that's why it's really important to look into videos on how to properly breathe during birth. And I will keep my mouth open as I am pushing, because keeping your mouth open and having low moans is the way you can safely push your baby out to avoid baby coming out too quick, which is what happened with my second birth and tearing me up, or baby coming out too slow with my first birth. I think I'm having one.
Okay. All right, dear. Let's take a nice deep breath. Pull those legs back and push. And you want to hold your breath, okay? You want to, let's practice this. So you're going to take a nice deep breath like you're jumping in a pool. And then you're going to hold that breath, okay, for at least 6 to 7 seconds. 2, 3, 4, 5, 6, 7. Good job. 8, 9, and 10. And okay, you don't want to blow out. You want to hold that breath, okay?
I'm scared of
That's okay.
holding the breath.
Good job. 8, 9, and 10. And again, one more time. Come on, you can do a push, 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 push. 2. Good job. 3, 4. Okay. So don't blow out. You see, you're going to hold that breath and just push, okay?
So that's what I'm going to do. I'm just going to make sure that I change positions, do what's instinctive to my body. What's my body telling me the best position to be in?
The reason that it would take longer is if the baby is in kind of a funky position, and so like it's coming out, head up or whatever.
I don't want to give birth on my back.
Another thing to avoid hemorrhage, and again, this is not me telling you this as a doctor, this is something that I want. I don't want any cord traction. So when the baby does come out, I don't want them pulling on my umbilical cord trying to get the placenta out. I would prefer that I naturally, since I started this whole process naturally, I would prefer that it naturally falls out of me. And obviously, if there's a problem, like it's been too long and they need to intervene, I will allow that. I just need to know the reasoning behind it. Another thing that I want to do is I want to keep my baby with me in the room, and also tell them not to interrupt my sleep. So you'll find that in hospital births, they have a night shift nurse and a day shift nurse, and I know those nurses are only doing their jobs, but basically what happens is you give birth and then you're not really allowed to rest, and the night shift nurse comes in and then they're probing you again, they're probing the baby, they're waking the baby up, they're waking you up, and you literally leave the hospital feeling wrecked from whatever days you're gonna be there. You leave the hospital feeling wrecked because they just did things on their own timelines. But what I'm gonna do is I'm gonna communicate to them, hey, I just gave birth. I would love it if you don't interrupt my sleep. I'm gonna sleep from 10 to 6 a.m., for example. Please don't walk into my room unless it's medically necessary. And again, when I say medically necessary, not because it's the hospital's policy, but because somebody's coding in the room or something bad is happening. I don't want you to interrupt my sleep. I just gave birth and I need to relax and wake up refreshed for the next day to take on my few months of sleep deprivation that's coming my way. So I really believe in communicating that nicely to the nurses, to the doctors. If something can be postponed till morning, like a hearing test for the baby, please wait till morning. Don't walk in at 1 a.m. in the morning into my room, waking me up, waking baby up. Another thing that was huge, especially with a first birth and a tear, is the pain meds. They had me on prescription pain meds. They had me on Percocet during my first birth. What that did is that constipated me, but nobody told me that that medication constipates you. They didn't tell you, well, here's the side effects of this pain med, especially with you having a 3rd-degree tear. They didn't say that it's gonna make my first bowel movement so scary because you're so scared of splitting open your stitches. If I knew, I would have at least not taken the pain meds or taken a stool softener the day before or taken a stool softener right after the baby comes out. So one thing I'm going to be doing is right after I give birth, I'm going to be taking a stool softener. Another thing that really ties into an epidural birth, some hospitals will say they have something called as a walking epidural, where basically it takes away some pain but not completely numb you, so you are able to still move around if you really need to, minimalistically, or maybe give birth in a different position other than your back.
Here's another option. I would probably do a quick consult just to make sure that my coworker is on board with this, but there would be no problem with placing the epidural and not actually turning it on, or turning it on very, very, very lightly so that it kept that line open, but it was not making you numb. It just would be in place so that if at one point when the Pitocin starts and you're like, I need relief right now, then we could hit start, and hopefully at that point it would be the 20 minutes for it to set up versus the 20 minutes to put it in and the 20 minutes to set up.
One huge thing that I will be doing is I will not be giving birth on my back. I am working against gravity, which means I have to push harder to get that baby out, which means I'm opening myself up to more birth trauma and more trauma to my pelvic floor. So I will not be pushing on my back. It is really important, and from me following pelvic floor therapists and going to many pelvic floor therapists, it's really important that you're able to move your back when you're giving birth and your pelvic floor and your legs. If you're not able to do that to accommodate the baby coming out, again, interventions are going to be done, and those interventions are going to lead to trauma. The only reason I would take an epidural is if I was told or I could feel that I'm unable to relax my pelvic floor. If I'm unable to relax my pelvic floor and completely let my pelvic floor open up, I will consider an epidural towards the end, around 7 centimeters dilated, just to enable me to allow to release my pelvic floor muscles and hence obviously not tear. The other reason I would take an epidural is if I end up, and I really hope I go into labor during the day when I'm well rested. It's 1 a.m. About half an hour ago, my water broke. So I was asleep. Suddenly just a gush of water came out twice. But if I end up being in labor for some crazy reason for a very long time and I'm unable to relax my body, that is another reason I would take an epidural, but again, at the end of the labor. One thing that I made a mistake with my first and second birth is I took the epidural way too early, did not even feel any labor pains. And in the first situation, as you're aware, they had to pull him out. And in the second situation, my bladder fell asleep. The other thing that I'm gonna do is I'm not allowing any visitors. This ties into manifestations and emotional health as I'm giving birth. I do not want more people in there. I don't want to worry about people being in there that do not necessarily make me comfortable. I want to be in the optimal, most relaxed state. I'm going to be looking at this whole process as an orgasmic experience, orgasmic euphoric experience. Weirdly enough, I can't wait to experience it. I feel like I was robbed of it my first 2 births. If you ask me how does a really bad contraction feels like, I wouldn't even know what to tell you because I didn't experience it. I feel like I need to experience it, not because I want to be a hero or anything. I think it's something to protect my pelvic floor, number one, to protect my mental health after birth, which is something that's going to last for a few months. So if you end up with a really traumatic birth and sleep deprivation and being tired and breast pumping or nursing, believe me, the pain of birth is probably going to be nothing compared to the pain and emotional and physical agony that's gonna come after it. So I really want to envision a positive birth and envision my cervix and my pelvic floor basically opening up and letting the baby out and breathing him out, no matter how big he is, because I was already told he has a slightly bigger head than average, which my first baby did as well. So I'm not afraid of that. I'm actually already emotionally prepared by listening to that book, by looking at other YouTube videos about people that had successful hypnobirthing experiences, and being aware of why certain things happen, being aware of why our healthcare system may push certain things on you. You're preparing yourself to have the best birth experience possible. I plan on changing the way I think about birth. I envision it to be something that I really want to experience as a mom, having her last baby. I want to experience that. I want to be able to come back on here and say, here's a difference between epidural and natural birth. But at the same time, I'm not going to set completely unrealistic expectations because I don't know my body in that much pain, or so they say, or so the movies say. So I am open to other options if I need to be open to other options, and that's how I'm going into this birth. I'm saying, bring it on, let's do this. Our bodies are made for this. You are made to give birth to your baby. As long as you do it naturally with very little intervention, your body's made for this. Educate, empower yourself. Most importantly, empower yourself emotionally, and you will have a great experience. You are awesome, and remember to be a shark. This is what a 35-week baby bump looks like. Wish me luck, guys.
Go ahead, push away. Go ahead, push. There you go. Great job. Good job.